All right, joining us now to discuss growing concerns over government's refusal to restrict entry into the country and level of safety awareness in marketplaces is Ehi Iden, is the CEO, Occupational Health and Safety Managers. It's nice to have you join us this morning.
It's so good to be here.
Great.
Good morning.
Very good. Now, the Nigerians have been especially listening to what Ghana, South Africa, Rwanda, Kenya, and other African countries drastic measures they're taking, restricting entry into their countries from certain places. Nigerians have become a little apprehensive, saying that why shouldn't Nigeria do the same thing if other African countries are doing the same thing? In fact, if you even compare, there's more traffic of people coming into Nigeria from across the world than in those countries. What do you say, or what have you heard?
I think the state we are right now, or the phase we are currently facing globally, there is an urgency to define what we'll call the new normal, the new normal situation. When we had the luxury of time and resources to deal with things under normal circumstances, yes, we will say let's follow a certain guideline. But right now, we don't, like I read that we're following the WHO guideline, that's why we're not banning flights. No. If you want to wait for guidelines to take decisions in such with the reality on ground, you will not make any decision. I don't know why we have to allow flights to come in when diseases travel faster than human beings can travel. Yeah. And all that we've had in Nigeria, cases that we're not supposed to be dealing with that came from different countries. And it's just natural. I mean, look at countries across the world having a lockdown and having restriction of flights to their country. I mean, Russia did that long ago. Australia did that long ago. Other African countries actually making some very, very credible decisions on this issue. But while we are opening our borders and opening our airspace for flights to still flying, is what I don't know. But
if you look at the situation in Rwanda, these are legitimate, this is a legitimate position from your end, but a country like Rwanda says its country is still open to tourists. And like you said, the WHO has given guidelines, but then it doesn't want countries to take this mode. Should that be the issue now, imposing this ban? Or if you look at the third case, the lady that came in, at that point, couldn't we have a system where from someone that comes from UK needs to just be taken into isolation, so to speak? Can't we begin from there before we impose an all-out ban?
Okay, you want to select people that come from high-risk countries. Yes. But wouldn't have been easier if you have a blanket situation where the people have no even reason to enter your country in the first place. Because when you now start selecting people, this you go into isolation, this you go into isolation, you are not from a high-risk country. But remember, they intermingle within the flight. So at the point we are in right now, I think it's a decision that the government have to make. Because at the end of the day, we have a very fragile healthcare system. And if we bring in issues that will overwhelm that system, at the end of the day, I mean, it's going to be very worse here. But from all that we're saying, we've not had those very decisive statement from leadership that we should do this. But we've seen countries, even Morocco did that yesterday. Kenya have done theirs. So I don't know why. Nigeria is not even an aviation hub to start with. So if you look at it, whether it is because of economic issue, but if you look at it from that dimension, you cannot sacrifice the life of Nigerian citizens at the altar of economic gain.
All right, but however, one way or the other, WHO, Michael Ryan, who is the executive director of WHO Emergency Response Team, had even used Nigeria as a reference point as to when it comes to efforts by government, efforts by agency to contain the virus, which is commendable on one hand.
Absolutely, yeah.
So if you see from the window of the fact that mechanism is on ground, machinery is on ground to ensure that whatever comes in is detected, from that window, wouldn't it be right to say, well, government is on top of the issue?
We must at that point give credit to NCDC for what they have done in this direction. But
their enlightenment alone goes a long way.
That's very credible. But when within the strategy, we are seeing things that will be counterproductive to what we have put in place. I mean, it's not a one-size-fits-all approach. Let's review our system. We are doing this, but when we leave our borders open and we allow flights to come in, and we have this influx of people that have coronavirus, and when the figures multiply, are we able, with what we have, to manage these people or these cases comfortably? The answer is no. So instead of using those people who are coming in to mess up what we put in place, it's better we have a restriction on those flights so that we can limit people that come into the country with new cases, so that we have the capacity, what we have, to manage what we currently have on ground.
All right. Ehi Iden, thank you so much for your insight into this.
Thank you.
Joining us to discuss growing concerns over government refusal to restrict entry into the country and the level of safety awareness in marketplaces is Ehi Iden. He is the CEO, Occupational Health and Safety Managers. Welcome, Ehi.
It feels so good to be here.
Nice to see you.
Absolutely. So we have 3 cases, confirmed cases of this virus in the country, but then late yesterday, there were speculations that perhaps there could be a 4th case, this time around in the regular workplace, until the Ministry of Health here in Lagos said tests had been carried out. The Indian in question came out negative, but tests will be carried out later today. So it brings us now to is the workplace itself prepared for this coronavirus now of a thing? Now, are we seeing the HSC standards now foresee a scenario like this, and how prepared are we?
We must first understand that the workplace was not built in isolation. It is within the context of a society where the coronavirus is. So I think what we should be doing right now within the workplace is to first, not even now, we should have had we design what you call incident management plan, an end-to-end plan on how we can actually prevent coronavirus in our workplaces. And at the center of that incident management plan, you have what you call employees, education, and our awareness program. What we're currently using is what you call the employee and employee family approach. And what that means is keep educating employees every day. Part of your daily toolbox talk, coronavirus issues should be an integral part of that talk. And what that means is that educate your employee, create an awareness on coronavirus, the trends as things develop every day. You keep talking about it in the workplace, open the conversation. Then encourage every employee to go back home and pass the same message back to their loved ones and their world. Because an employee could be safe in the office by the kind of education he got. But he has a family, he has a wife, he has children. And any employee who cares, whose wards or wife or spouse contact this virus, and the employee, it's just natural that you have to care for your spouse. We care for that spouse and bring the virus to the workplace. So you just have to, this is the trend we have to use. And again, we understand also that social distancing has also been a very critical part. But we must also understand that within the workplace, there are a lot of commonly shared items,
Absolutely.
Mostly the desk surface. As at today, we're encouraging workplaces to increase or have more hand washing points. Like we said the last time, sanitizers are good, but you can only rely on sanitizer when you don't have access to running water and soap. Okay? Then we must understand that the research that came out, the report that came out on the 11th of May, of March, says that coronavirus actually can survive in plastics, right, and other form of materials within up to 3 days. So having that in mind, it means things like banisters, rails, cell rails that we have in the offices, the elevator buttons that we have, television remotes, AC remotes. We need to start looking at how do we...
Elevator buttons.
Yes, how do we disinfect those things? Now the sanitizers can actually help you disinfect your hand, but you can't use sanitizer to go and clean those things. What do we do now? We have to see how, because even researchers have said that common household disinfectants can deactivate a coronavirus within minutes.
So take them to the workplace?
Yes, you can. What you do, you can actually use disinfectants that have up to 62% to 70% ethanol, that have up to 0.5% sodium hypochlorite, that's bleach, or has up to 0.5% hydrogen peroxide. And we have such disinfectants. They're good enough for you to actually use to clean your surface in the office, ensure that those areas that people must have touched, or suspect victims have touched, you use that to wipe it so that it can keep it clean for people to use.
Let me ask you this. The point there is the bureaucratic space, what we call the corporate space, is a world benchmark. But if you want to narrow it down to our everyday lives, when the culture of who we are, our communal life, how does that play out? How does that become a kind of an obstacle to achieving what you're saying? Because what you're saying is a protocol. That's what it's supposed to be. Yeah. But you see, because we relate and commune, and that's our culture, that's our life. Exactly. That's.
I totally agree. I totally agree. But we must understand when we have an emergency at hand. Like I said before, we develop a new normal behavior. Right. When I came in, when Nero was trying to shake me, it was my leg I gave to him because we have
the elbow shake.
Yes, we have to start doing those things.
But can you really keep at it? I mean, you see somebody who just bumps into you knowingly, coming to greet you. Can you really keep at the leg
as much
thing?
as you can, as much as you can. May not be 100%, but as much as you can, because
knowing that we have to be safe first before we continue to become brothers.
Exactly. So understand that new levels of behavior have to be cultivated. It just will last for a time, this window that we have of this coronavirus invasion. But when this phase is out, we can go back to our new life. But we must ensure that my safety is your responsibility. Your safety is my responsibility. Right. So we must help ourselves to put through this phase. It's going to be okay, but we are in a very terrible situation right now. We must collectively come together and ensure that we forcefully go through our business.
All right. Thank you very much.
My pleasure.
From the Occupational Health Standards, Health and Safety Managers. Many thanks, Ehi.
Thank you.
Well, joining us now to discuss growing concerns over government's refusal to restrict entry into the country and level of safety awareness in the workplace as we know it. Ehi Iden, CEO, Occupational Health and Safety Managers. Thank you very much, Ehi, for joining us on the program. So it appears that the tide is on now. The NYSC camps have been shut nationwide. Where does this all fit in? If you look at the sports festival also postponed, where does this all fit in now in this national sensitization?
I think that's a very good approach, which of course we must give commendation for, because now we have to see how we can actually discourage large gathering, crowd of people, which of course is what we have done right now. I think it's part of the overall strategy that we're using in the country. But you remember earlier on I talked about things that were normal when things were okay and no longer normal right now. That's what just happened right now. So this sports festival and the NYSC camp could have continued, but based on what we have right now, it's not safe. So it's no longer a normal thing for the camp to continue. So we have to suspend it. And I think this is just really good. I think more of such decisions we want to see coming up.
Like what?
We know, like we talked about the ban of flight. And not just that alone, we have to see how we can start putting more of this information, because from this one I had shortly, a number of people in the country still do not know what coronavirus means. We have to strengthen the information dissemination in terms of coronavirus awareness and education. If it means translating the messages into local languages, a man who is in Damaturu does not understand the Queen's English we speak about coronavirus in Lagos. A man who is at Ogoja downtown does not understand what it means. So we have to see how we can actually break this down into their local languages, and like I said the last time I came here, let's partner with the telcos. Information, this SMS can be going out to every subscriber every hour or every 2 hours. This is what we're talking about in English, in their local languages, so that everybody's carried along. The more we know about coronavirus as a people, the more we are able to combat it. But when some people know and some don't have knowledge of it, find out that the ones who are weak within the chain get the whole process messed up.
All right. Now that government is taking drastic measures, now the National Sports Festival has been postponed. The national orientation by NYSC has also been rescheduled, so everyone has to go back home. There are still instances where Nigerians are going to gather in large numbers. Our open markets is another, in fact, it is even less structured, where market women in fact, we're talking, like you said, we're talking about coronavirus right here now. Some of them don't even know what coronavirus is all about. There are also worship places, worship centers and all of that. Because these things are going to happen every day when it comes to revivals and church programs and Jumat prayers every Friday and market visitation and to buy things. This thing is going to go on every day. Do you see any likelihood of the government thinking in that regard?
You know, this is where I talk about the issue of engagement.
Okay.
We have to, as a government, we have to see how we can engage all these gathering leaders. They have leaders. We have to look at how we can engage the leaders. The mosque, they have a leader. The church, they have a leader. The market, they have market women association. We have to start. These are the people who should start engaging, because when you engage these people, the message will distill down naturally. We have to see how we can open up. It's not to stay in Abuja or stay in government house and be talking from television. Let's be on the street, engage these associations, this leadership of all these groups, and let them understand what coronavirus means, what the government expects them to do. Because when it comes to disaster management, everybody needs to know what his role is within the chain. And if this is not well communicated, we miss it, then we leave everybody vulnerable. So they need to be communicated. These are your roles. This is what we want you to do, so that everybody along the value chain, they understand what it means, what they have to do, and take the right decisions.
And runs with it. But at this stage now, and looking at how the coronavirus is being battled in other climes, would any step be considered drastic? Like we've seen offices abroad, telling their employees not to come to work, let this, pass over, and then you can come and work from home. In Nigeria now, you talked about the marketplaces now. Would you, as a specialist now, consider any effort too drastic, or just do everything you can do?
No effort or decision that you make at this time is too drastic, because what we're facing right now, I mean, it's a critical issue, and globally everybody is making such decisions. But you have to also look at what is the prevalent within us. I'm sure that's why you see that workplaces have not been closed and then the people are still allowed to come to work. But when it goes beyond this and it becomes higher than the rules that we have right now in terms of assessment, then people might have to work from home. And this is just how it has to be. So any decision that is made by government as at now is not too drastic, because government is the custodian of people's public safety. They just have to do it, and we have to comply. Right. Compliance is very important.
It's okay.
All right, Ehi Iden there. Thanks a lot for your contributions.
My very pleasure.
Thank you.
Thank you.
Right.